Now, meanwhile, to the crisis in Victoria, Melbourne's been locked down for more than 2 months now, even though there were just 7 new infections today. Just seven, plus 5 deaths, 4 in aged care. That's the real concern for me, the deaths. Just 7 infections, Melbourne locked down. But New South Wales today, 11 locally acquired infections, and Sydney basically open, although further easing of restrictions has now been postponed. Now, if you don't live in Melbourne, I don't think you can really understand the damage done by these bans. The people that have lost their jobs, the people that are being driven crazy by being forced to stay at home, the suicides, and more than 800 businesses a day now signing up to JobKeeper to stop from collapsing completely. The revolt now is really taking hold. More than 500 doctors have signed the latest petition demanding the lockdown stop. And now there's a push by small business, the Let's Be Open campaign, backed by some of the state's best-known business leaders, with a full-page ads now in the paper demanding the Andrews government release the evidence to prove that this lockdown is actually needed. That campaign is organised by Small Business Australia's head, Bill Lang, joins me now. Bill Lang, thank you so much for your time. What damage has been done by this lockdown?
Oh, it's an enormous mess to so many people's lives, Andrew. You know, at Christmas time, we had 600,000 small businesses here in Victoria. About 350,000 are sole traders. Back of the envelope with some of the research we've been doing, we could see 1/3 closed forever. And the implications on those small business owners, their families, not to mention all the people that are employed. It's 1.4 million people whose livelihoods come from small businesses here in Victoria. And these small business people are the hearts and souls of their local communities. It's more than the economic backbone. You know, who provides the work experience for the school kids? Who donates the prizes for the school raffles?
Absolutely.
Small business people.
Absolutely. Yep. No, it's so true. And, because people don't understand that. It's not just, greedy small businessmen trying to make money. They're providing jobs. They're centre of community, shoppers coming past. It's just knocking out a really important part of our life as well as the economy. What is your campaign demanding?
Look, there's a few things. Like, at the end of the day, the citizens want to trust their government. But to be trusted, of course, people need to be trustworthy. To be trustworthy, you've got to have a good character. You've got to be competent. You've got to have some commonality with the people that you're leading. Now, without being able to trust the government, it's very difficult for people to have confidence. We have some business owners that are keen to reopen, but is it all going to get slammed open again? So there's 3 or 4 key things, Andrew, that we're after. The first is a whole of health impact. We appear to have Professor Sutton would appear to be the chief COVID officer in Victoria, as opposed to the chief health officer. And now we're seeing that in many respects, the cost to the health of all Victorians is far greater than the cure that they've been putting in place on that. The second area then is around the capacity of our health system to deal with a 3rd wave or a 4th wave when it comes. There's now more than 1,000 ventilators. You do some back of the envelope numbers. Small business people are pretty practical. It may be 10 or 20,000 simultaneous positive cases that the health system could deal with. But what is that? Then the 3rd area is around tracking, treatment, tracing, testing, and the absolute fiascos. We've still got people using pencils and paper down here, whereas, the gold standard is New South Wales. I think there's going to be bigger issues than actual quarantine around how were the decisions made around how the whole tracing process works. Why isn't the smart technology getting used? We get 100 emails a day from business owners.
I agree.
Why aren't we using the QR code in New South Wales? Like, this is just ridiculous. And then finally, of course...
Look, I'd go further. You're right. Why with quarantine aren't we having electronic testing of where people actually are to make sure they are quarantined and not roaming down, down the street shopping or whatever? Taiwan does this, Singapore does it. We simply can't do it. And as for the ICU machines, do you know there's not a single person on these ventilators that we were told we needed, 20,000 or whatever the figure was, not a single person in Australia on them. And I thought it was all about suppressing the curve so that the hospitals won't be overwhelmed. They're not overwhelmed. So I agree with you. We need the evidence. If you don't get the evidence that this lockdown is medically justified, what are you going to do?
And look, now we've got tens of thousands of citizens, concerned citizens, Andrew, that are coming to our website, getting our citizen action plan, and in a very courteous and a very respectful way, just asking in this free democratic government society we have here in Australia and Victoria, just what are the facts? Share them with the people. Share that we're adults. We're already doing all the sort of key things that we can do as individuals to reduce this. We need to be open. We need to know that we can cope with whatever else comes on. The people have been so frightened by all of this, Andrew.
Look, I totally agree with you. I tell you what, if they don't have a medical rationale, and I suspect they don't, they're going to be in huge legal problems. In fact, there's a case being brought now to court by a Mornington Peninsula hotelier saying, well, if you don't actually have reasons for it, you could be in jeopardy. And we'll see. I wouldn't mind betting that, like with the curfew, as soon as it's taken to court and they've got to produce their reasons, boop, end of lockdown. Anyway, we shall see. Bill Lang, thank you so much indeed for your time, and keep fighting.
Thank you, Andrew.